This is Karen with NewClevelandRadio.net, and it is time for Care Notes with Doug Wilber from Cherished Companions.
Hello, everyone. This message is really today going out to our clients, and we want to be able to help give some updates on COVID and some thoughts that we think are really, really important for those who are our clients to understand right now under the particular conditions that we're dealing with. I have Molly Patel with us. Molly is our nurse, and Molly has a phenomenal background as an ICU nurse at the Cleveland Clinic, was there for, I think, 18 years. So dealing with situations like this, although it's unique, what we're dealing with has been a backbone of the training that Molly got. And so she's remarkably suited for being able to help under pretty unusual and difficult situation like we've had this year with the COVID-19 crisis. So Molly, I'm really going to hand it over to you and want you to give us some insights and thoughts for the families that are out there that we're helping to care for.
Okay, thank you for that very kind introduction. I appreciate that. I'd like to really just kind of lay out some basic things to be focused on today. What sort of steps we can take as families and clients to prevent being exposed to COVID-19, or also to try to reduce that risk, and then what to look for as far as symptoms, and what to do if there are serious symptoms, and then also just a quick mention about getting a vaccine. As far as the way that COVID-19 behaves, it is an airborne disease, which means as people breathe or speak or cough or sneeze, those particles get spread throughout the air, particularly in a closed environment like a room or a household, and less so when people are outside in the open air. But unfortunately, in Cleveland winters, that's not a real reality for most of us. And so what I would recommend for our clients and families is anybody coming into the home, either aides or nurses, therapists, other family members, have all of those people wear a mask, even if it's just a simple mask. We call this source control. This is, I don't know if you can see this, what a simple mask looks like. Anybody coming in would just wear that over their nose and over their mouth and chin, and that keeps their potential germs and airborne pathogens from spreading throughout the room. So that's a real important thing for anybody coming into the home to wear that the entire time that they're there. And we recommend for aides or nurses who are needing to take a lunch break, but they're still on duty there, to go in a separate room while maintaining patient safety, and have their lunch in a short period of time in a separate room. And then when they're finished with their lunch, they put the source control, the mask back on, and continue on with their care. We also are finding that, many of the cases of spread that we have had among our patients and among our caregivers have come, unfortunately, from other family members of that patient, just unknowingly, because people will be contagious for 48 hours before they develop any symptoms of COVID-19. So people are completely unaware that they could be spreading this virus because they don't feel sick. And then, a couple of days later, end up feeling sick and realizing that that 48-hour window of time beforehand where they weren't feeling sick, they were spreading that pathogen to their family members. It's happened several times, and that's something that we want people to be aware of. It's when we're with our family, we tend to be more relaxed and think that everything is safe and nobody's feeling sick. So it's easy to assume that you're not spreading anything, but we just want to caution people that it's possible. The next thing I wanted to mention was monitoring for signs and symptoms. Taking temperatures are important, of course, but 40% of people who get COVID-19 never have a fever. So you also want to look for, particularly with our elderly people, them not acting like themselves. They seem off, sudden sadness, sleeping more than usual, feeling lethargic, losing energy, losing their appetite, not eating, fatigue, very mild, even cold-like symptoms, little sore throat, drippy nose, sneezing, coughing that doesn't seem real severe, could actually be COVID-19. Body aches, a little extra soreness, and a lot of people also are experiencing some loose stool and diarrhea. Those are the most common sorts of symptoms that we're seeing people have. And those are the things you would want to monitor for. People who tend to get more serious symptoms, it seems like serious symptoms are starting within that second to third week of the course of the illness. And they might start off with very mild symptoms that, oh, I just have a cold, I'm okay, I just have a cold. And then that second week, they can, get more serious symptoms like being very short of breath, or their oxygen saturation drops below 94%, or they may get chest pain, extreme lethargy, or persistent diarrhea, and potentially not being interested or willing to drink anything. In that situation, any of those things happening, that patient needs to be seen at the hospital. And so I would recommend to act quickly on that for our clients and family members. If you are getting more serious symptoms, do not hesitate to get to the hospital. And the last recommendation I would make is talk to your doctor about getting a vaccine. We have 2 vaccines available right now, the Pfizer vaccine and the Moderna vaccine. Both of them are 94–95% effective. Very few problems at all with side effects. The side effects that people are having with those vaccines, a little bit of soreness at the injection site, a day or two of feeling malaise, not just kind of feeling not yourself, fatigued a little bit, and then that goes away. There have been a few allergic reactions that people have had, but I believe it's only 6 allergic reactions in several thousand injections. So it actually is a very low incidence, and we do have allergic reactions with every vaccine that we put out there. So it's not something that is more, it's not going to happen more with this COVID vaccine than it would with the flu vaccine, for instance. So do talk to your doctor about getting that vaccine. The vaccines that are out right now are 2 injections. I believe they're 3 weeks apart. You have to finish up both of those injections to have completed your vaccine. Doug, do you have any other things to add or questions about that?
Well, you know what, actually, just a couple thoughts. One is how often when we have seen issues that it's come because of that comfort level with families, where families have accidentally introduced COVID into the situation because of the fact that family members are not wearing masks, whereas other people coming in typically are wearing masks. The other thing is people should not be hesitant to ask anyone who's in their house to wear a mask, period.
Absolutely.
I
Yeah.
would I would even have extra masks and say, please wear it when you're in there. And it really should be a mandatory thing. We're so close with people being able to get vaccines. I really think that having a little bit of extra vigilance is really important. And then finally, to wrap up, the idea of getting the vaccine, the sooner people can get it, the better. So talking to your doctor early, and because in the state of Ohio, they're prioritizing certain groups, and one of those groups is the older population. And so the older population is the one that is largely being affected by the worst parts of COVID. And so it's in order that they are actually prioritizing older folks for doing it. So the sooner you can get your doctor or with a home healthcare nurse or others that are involved to get that injection, I think the better off people are going to be. With that, hopefully this is a quick insight that will help folks in the coming weeks. And I hope the next time we talk with our audience of people that we care for, it's going to be on a whole different subject, and Lord willing, that will be the case. With that, I wish people all the best in the new year, praying that 2021 will be a much different year than 2020. So blessings to all, and thanks.
Have a great day, everybody. Stay healthy.